I'm JD, and this is the Christians for Impact podcast. We talk to Christians about the world's most pressing problems and what you can do to impact them during and after university. In today's episode, we're talking with Nicolas Laing. He is a very charismatic doctor from New Zealand who, for the last 10 years with his wife, has lived in rural Uganda. They run OneDay Health, which is a system of rural healthcare clinics providing much needed healthcare supplies and treatments for diseases that cause like 95% of mortality in the region. He's working in so-called healthcare black holes. These are regions that, if Nick wasn't in, would not be getting the healthcare they need. We talk about that. We also talk about Nick's dream for expanding and growing OneDay Health from over 40 clinics right now to something much, much bigger. We talk about Nick's faith and how it was that Nick became so inspired to serve the poor and be a healing hand, just like the hands of Jesus. We talk about radical stewardship of money and how Nick lives that out. We also talk about effective altruism and what both Christianity and effective altruism can learn from each other. And finally, we touch on Nick's advice for young Christians who want to have an impact, especially doctors who are interested in having an impact through their work, not just by earning to give like what Jason Dykstra does, but by doing direct work in the most needed places. I love this conversation and I really love Nick. So I hope you do too. And let's jump in. Nick, thanks so much for coming on.
Thanks, JD. So excited to be here. Love this podcast.
Really happy to have you here. Could you take a second to share a little bit about yourself, how you stay busy, and how it is you aim to impact the world?
Sure. So I'm Nick. I'm a doctor from New Zealand, and I've lived and worked now in Northern Uganda for the last 10 years. It's quite funny. I actually wanted to be an engineer at school, but I failed maths so badly and when I was 16 that I changed my mind and was really fortunate that I got into medicine. And I mean, people often ask, how did you get into medicine? And the first thing I always say is that, I was very, very fortunate. I mean, I was born into an incredible, loving, curious, middle-class family that valued education a lot. And I like to say that I kind of won the geographic and socioeconomic lottery, and that's what allowed me to get here. And I became a Christian when I was 15 through this incredible, loving youth group, but I never actually became part of a church until I went to university. And it's amazing. People ask, why did you want to become a doctor? And I call it luck or fate or the hand of God. But I'm super grateful I'm here because I love people and thinking about how to care for people. So medicine's a great place to be. Yeah.
That's incredible. So what is it exactly you do now as a doctor? And you're also from New Zealand. You went to medical school there, I suppose.
Yep.
And you're not there now. So walk me down that road a bit.
Yeah. So how did I get there? Well, in my first year of university, I had tutorials every day of the week, Monday, Tuesday, Wednesday, Friday. And it just happened I didn't have one on Thursday. And there was a Justice Bible study group on that Thursday. And I'll never forget, I went to the group and the first question that the leader asked me was, asked the group of us she said, look, I'm just trying to raise money at the moment for World Vision. And my friend's a really heavy smoker. And I just gave him 2 packs of cigarettes. So he'd join the the donation to World Vision. What do we all think of that? Discuss, and that's the first hour of justice conversations, involving the trade-offs and the stuff. So that's kind of how I got into it. But more important than that, as part of that group, every Friday, we would go to a dinner, which was set up by a local church in a poorer neighborhood. And we would just help out. We'd talk to people. And I was from a middle-class family. That was the first time that I saw kind of people who were poor and struggling and a whole different side of life. And I connected that with the Bible and justice. And I think in my second year of medical school, I kind of came up with the idea that, hey, maybe I should be thinking of working in a place where maybe I could do more good, or where I'm needed a little bit more than in New Zealand, where there's already a lot of doctors. And of course, my motivations were very naive. They were a mix of faith and ego and compassion and white saviorism but also a lot of love and energy and kind of mixed in with all that. And I suppose, to cut a really long story short, my My wife was also really passionate about similar things. She's a community organizer and an activist. And we joined CMS, which is the Church Mission Organization, which I can talk a bit about because I'm really passionate about it as well. And we came to Uganda 10 years ago, and I've been working as a doctor and managing health centers, and then launching this organization, OneDay Health, which I'm super excited about as well.
And sort of the OneDay Health in a nutshell is that you train local nurses and local healthcare providers to identify really common, really deadly diseases like malaria or pneumonia and some others, and you equip them with like the essential medications to treat the most common conditions. And you've done this across 40 clinics in rural Uganda. Is that right?
Yeah. So I'd say it's that, and it's even more. So when I first went to Uganda, I started working as a doctor. And then I was asked by the Anglican Church to run some of their health centers. I mean, all around the world, the church was often the first people to launch health centers and hospitals, and that was the same in Uganda. But in Uganda, still, about a quarter of healthcare is provided by the Catholic Church, the Anglican Church, the Orthodox Church, Pentecostal churches. And so I was asked to join that system. But as I was moving, me and my co-founder, Emma, we were moving between these bigger health centers. We'd encounter communities, we'd eat a chapati on the side of the road, and they'd ask, what about us? Like, you're moving between this health center and this health center, but those health centers are 10 kilometers away. So what about us? And we kept getting these questions, these challenges from these communities that were in what we now call healthcare black holes, places which don't have access to healthcare. And in Uganda, there's actually 10 million people in these remote rural healthcare black holes. And when they get sick, they have no good option. And they can either spend a crippling amount of money to reach a distant health facility or wait and hope the illness gets better. And I always say the human body is an incredible thing. And it's amazing ability to heal itself. But without medical care, sometimes it doesn't. It loses. And so we asked ourselves, how do we solve this problem? And we came up with this idea of launching really basic health centers in rented buildings operated by nurses. So how this thing works, we identify these healthcare black holes. We don't just go there along the road anymore because we're too big for that. We've got
You don't just throw darts at a map. You have a system. You have a process. Yeah. How do you find those? Is there a threshold for what's a healthcare black hole or not? That's such a jarring phrase too. It really caught my attention when I read it. It's really a foreign concept to me. I mean, I guess in the U.S. you do have areas where healthcare is less secure, less safe or immediately available, but it's not a black hole, right? It's such a powerful, dark idea.
Yeah, and the thing is, it's only a black hole because of the extreme poverty. Like, if you're 5 kilometers from a health center in America, you jump in the car and you get there in 15 minutes, 10 minutes. It's a piece of cake. But if all you have is walking, and your 5-year-old kid is a bad fever with malaria, then 5 kilometers can just be too far, too difficult, and it's pouring with rain. And it can be the difference between life and death. But how we find them now, we actually have a really cool app where we can just put a circle on. We've mapped all of the health centers in Uganda, and we can just put a circle on the map between those health centers, and it estimates the population for us. And we look for areas of between 3,000 and 8,000 people in a healthcare black hole, and then we go and visit it. We talk to the community. We ask them, look, is this a place where you really need us? Could you pay the small amount of money that's needed for the health center? And then if the community is really on board and it looks like a good place, then we train the nurse. We equip the place with 50 medications. We get a solar unit, which can charge the phone and light the facility for at night. And then the place is equipped with over 50 medications. So this ranges from tablets to antenatal care to injections and fluids to treat more severe diseases. So these health centers, these OneDay Health centers, can manage over 95% of the disease burden at under $2 a patient. So it's a super efficient way of providing healthcare in places which have this enormous need. And I love talking about launch day, because on the launch day we load the health center into a truck. So we get all the furniture, all the medication, the solar unit, we throw it in a truck, we get out there, and everything fits in a truck. Everything fits in a pickup. On the website there's a really fun photo of one of our nurses with thumbs up in front of the health center truck. And then on the very same day we arrive, we treat our first patients with malaria or pneumonia or a skin infection or whatever it is. Yeah.
And so when you say you can treat 95% of the burden, so you mean like common diseases, 95% of everything that can come up, you can provide some really low cost medication for with one of these makeshift health clinics.
Yeah, exactly. I mean, it's pretty incredible. We can do not so different from what a family medicine clinic can in the States. So we treat the acute conditions like malaria, pneumonia, typhoid, urine infections. We can treat high blood pressure and diabetes. We have about 8 tests. These new rapid tests have completely changed medicine. We would not be able to do OneDay Health without them. Now you can just
like the COVID rapid tests.
Yeah, you can,
but like for other diseases as well.
Exactly. You can get a drop of blood and see whether malaria, HIV, hepatitis B, syphilis. Obviously, we know about urine pregnancy tests and urine tests. So even without a power system, a good power system, without a fridge, we can now diagnose all these diseases with just a drop of blood. And we also, like we said, we do antenatal care and pre-referral injections as well. So we call it like the MVP, which can be both minimum viable product or most valuable player, either, of kind of primary healthcare. So like, what's the simplest way to provide a comprehensive package of primary healthcare? And I think that's kind of what OneDay Health does, yeah.
Yeah, that's incredible. So I was reading some analyses of the estimated impact of OneDay Health. And in those analyses, there was a lot of emphasis on malaria and pneumonia. Could you share a bit why? And because it sounds like you're treating a lot of different kinds of health burdens. Why all this focus on malaria and pneumonia?
Yeah, there's a really interesting situation in global health, which is a little bit hard to reconcile at the moment. And that is that a huge percentage of the mortality and the morbidity is actually children under 5 with just a handful of conditions. So you can take the whole population and all their health issues, and I don't know what the numbers are, but maybe half of the issues come from malaria, pneumonia, diarrhea, and kids under 5. And so we do treat that, but we also treat everything else. So there's a concept called universal healthcare, which you might have heard of. And what that is like kind of what we do, the minimum viable product of healthcare for everyone. So I think there's sometimes too much focus on just those few diseases because, yeah, we can find a solution for just them maybe, but then what do we do about everyone else when they get sick as well? So when we talk about cost effectiveness, usually we focus on just a few diseases and usually mostly children under 5 because that's where kind of the really, really big impact is. But in terms of what the community cares about, in terms of the community's well-being and the community's kind of saving money, the community's well-being, the community saving money, the future of the community, they really care about having a health centre that can treat everything because then they don't worry, when their kid gets sick or if they have blood pressure, they have a place to go. So there's this interesting balance between, kind of just focusing on the most cost-effective impact, but also providing the service, which is really helping the whole community. Yeah,
that's really interesting because I've often heard it said that, and I've read a lot of analyses about how cost effective it is to treat diseases like malaria or parasitic stomach worms like schistosomiasis or pneumonia, right? So, but you're saying that in a community, people have this felt need for universal healthcare coverage, whatever that minimum, that minimum universally available healthcare coverage is. That's what people are looking for.
Yeah.
Even if dollar by dollar by the public health experts estimate, that's maybe not like on average most effective compared to like specializing on malaria.
Yeah, and I think when you look at kind of utilitarians and the effective altruism community, that's the big focus. But to be honest, when it comes to the WHO and public health experts, they're also very concerned with universal healthcare and the whole community care. So I'd say it's not just the community, but in general, the public health community is very, very interested with universal healthcare, as well as kind of the community itself. But even putting that aside, like I think it is OneDay Health is still could be super cost effective. Just to be really, really clear, we haven't had an RCT done on OneDay Health yet, and that's a huge gap. And we're actually trying to work with JPAL at the moment, which is really cool. JPAL is a big organization which does RCTs. That's a randomized control trial. So the idea is basically that we'd choose 40 black holes, healthcare black holes. We'd randomly put health centers in 20 of them, and then see if the healthcare was better if the health outcomes were better where the OneDay Health centers were compared to where they weren't put. And that's kind of the next step. But based on our calculations, we think that OneDay Health might save a life for somewhere between kind of $1,000 and $3,000 which is really good compared to a lot of other interventions. And that's only taken into account a few diseases as well. So obviously that looks better, a little bit better at least, if you take into account the whole population and all those other diseases, which we're talking about there.
Right. And that's because I was looking at those estimates from OneDay Health, and you're looking at, I think you said you treated something like 150,000 patients overall, including 70,000 for malaria.
Yeah, it's actually, we've just ticked over. Sorry, I'm interrupting, but I'm excited because I just looked at our 2023 data, and we've just treated our 200,000th patient, which is like, yeah, let's go. And that's
so exciting.
And that's like over 90,000 patients with malaria, and we now have 40 of these, I think 41, 42. We actually had launched one on the 2nd of January, which I felt bad about. We should have, the manager and the nurse should have been on holiday, but we launched one 3 days ago, which was pretty cool.
That's also my birthday, which is a great day to launch a clinic like this. Awesome. So, and looking at those estimates, like that cost effectiveness estimate is based mostly on just the malaria pneumonia impacts, right? It's not even looking at almost all the other impacts we're doing, including this really hard to measure one, the psychosocial benefits of knowing, hey, like you are someone who's living in a rural village, you didn't have a hospital nearby, now you have a health clinic nearby that can treat basic diseases, and you have that peace of mind knowing if something did happen, you could go. I mean, I don't even know how JPAL's thinking of measuring that, or if they want to measure that aspect at all, but I'm curious what you think, like how valuable is that for the people you see?
That actually might be the easiest thing to measure. So well-being is a big new feature. There's actually, I mean, even within effective altruism, they're more and more interested in well-being now. And just the simple thing of asking people before and after, you know, how was your life before, how was your life after the OneDay Health Centre? So I'm hoping we can actually measure that fairly easily. The health outcomes are actually the really hard things to measure. Because like think about how do you measure the malaria prevalence in a community? You know, you have to go out there and test thousands of people and check, and the number of health centers and patients treated you need to like look at child mortality is huge, because healthcare is improving everywhere. So finding things which do improve child mortality and really nailing that down is difficult. So I'm actually hoping that looking at community well-being might actually be one of the easier things to measure in the RCT. Yeah.
Is Happier Lives Institute and those people measuring well-bees, are they interested in working with you? Maybe with this JPAL study, you could do it on the side, some kind of well-being analysis as well.
Yeah, I mean, I think it might not even be on the side. I mean, well-being is a fairly mainstream kind of topic now. I've had a bit of a talk to Happier Lives Institute people, and hopefully they can help support us with questions and that kind of thing. But I think it's great just to ask people. I mean, it's validated, and it's just to ask people, has your life improved? You know, has your life not improved? And it's amazing. I mean, who would have thought people are really good at talking about whether their lives improve or not, and that actually seems to correlate with other disease and life expectancy measures. You know, it's an interesting one anyway. It's a big discussion.
Yeah, to be clear, by on the side, I meant like as part of the program design, not like as some kind of secondary marginal concern.
Yeah.
Speaking of which, if there are any Christians at JPAL who are listening in who would like to come on the podcast, please let me know. We're really appreciative of what you do there. And that's really exciting. We'll definitely stay in touch to hear how that develops. I want to ask a question about the impact here, because, and if somebody wants to take a deeper look at OneDay Health's impact, one resource I came across, Nick, you can correct me if this isn't the best place to look, is this EA Forum post that you wrote in February of 2023, Remote Health Centers in Uganda, a cost-effective intervention, where you basically broke it down and said, hey, look, if you go through the numbers like I do, and you look at how many patients we treat for malaria, how many of these are like counterfactually significant by these criteria, here's how much it costs to treat people for malaria. And it's like plausibly within the same estimates as like GiveWell or better actually on your numbers. So, but one of the issues here is actually measuring that counterfactual, right? Yeah. Where counterfactual is what would have happened otherwise. And there's a lot of good discussion happening about like, well, without an RCT, how do you really know? And it sounds like you're very sympathetic to that. Yeah. But what do you think are maybe some of the bigger uncertainties about knowing how effective OneDay Health is?
I mean, there's huge uncertainties. Basically, the benefit of OneDay Health kind of comes in two things, potential benefit. One is if people get treatment faster. So it sounds a bit silly, but it's been studied, if you get treatment for malaria faster or pneumonia faster, then you're less likely to die, which seems obvious, but there's evidence that that's true. So the second thing is quality of care. So people getting better quality of care at a OneDay Health Centre, so more likely to get diagnosed correctly. There's actually a big problem with overdiagnosis of malaria in Uganda, a huge problem. Like, a lot of people don't give the test because they don't have it, or because it's too expensive. And that's actually a really major problem. So those are the two things. And of course, we're doing a lot of guesswork and figuring out, well, if they didn't come to us, they'd then get a vehicle, and so how long would that take, and how much worse would that be for them? So the counterfactual is so hard to estimate. That's probably the biggest uncertainty is, how much better is it for people to get the cheap care at OneDay Health compared to having to go a very long way? Yeah.
In your defense, OneDay Health has been operating in the last 5 years at $300,000 total budget over those 5 years.
Yeah.
So that's below the costs of some high-powered academic RCTs, right? So with what you have, I mean, I don't think anyone can discredit what you're producing.
And there's one of the ethical concerns, right? Because as we're looking to get an RCT, and the RCT will cost probably the same or more than all of the money we've spent on treating these people in these remote rural areas. The other thing I think is which I like to say, is that the cost effectiveness, it sounds fairly plausible. So if each one health centre, costs $4,000 to start and operate for the first year, and then if patients are bringing money, even if it's cost neutral for the patients, it's quite easy to consider, well, if it costs $4,000, and if it saves 2 or 3 lives, just that's all you kind of need to get to a really cost-effective level. So it is very plausible, if the health centre is only costing $4,000, you don't need to save very many lives for it to become very cost-effective, if that makes sense.
Yeah, so I want to dig just a little bit deeper here before moving on to some of the faith components of this work as well. But this matters, right? Because it's not just about proving whether OneDay Health at its current size is effective and impactful. There's really a huge amount of room for growth and for doing this across the rest of Uganda, I imagine, and in other countries as well. Let's say JPAL does a study and it does come out really promising. What does that mean for the expansion of OneDay Health? What are your big dreams for OneDay Health in the next 5-10 years? And, it's 40 clinics now. Could it be 400? Could it be 4,000? Wow,
big numbers scare me, JD. I'm more of a step by step kind of person. I mean, my board and my co-founders are like, Nick, think big, think huge, I'm always one step at a time. But so we've got 40 already. We think in Uganda that the scope of these populations between 3,000 and 8,000 people there might only be 100 or 120 total in Uganda. So our scope for growth in Uganda is there, but I don't think we could launch 400 in Uganda. So we've actually just visited Malawi. We did a big analysis of different countries where we might be able to help. I mean, the only reason we started in Northern Uganda is because that's where I was, right? That's where we started. So there's no reason to think that a similar model or a version of OneDay Health couldn't be just as effective or more effective, somewhere else. And so we're hoping to have a partnership in Malawi as well. There's a big organization called CHAM, which is, I think it's the Christian Association for Medical, and they provide an even higher percentage of healthcare in Malawi than happens in Uganda. So we're hoping to maybe partnership with them to move into Malawi and other countries as well. But I mean, the big thing that could help us to really, really scale is government. So what I'm really hoping is to convince the government that this is a really efficient way of providing healthcare. And then if the government could come in and really we could work together, then all of a sudden you have the ability to move into hundreds of healthcare and hundreds of health centers and scale much faster. And that's actually the way a lot of organizations have grown. So if you look at the community health worker movement, which is a famous movement all around the world, that was kind of pioneered in a number of places in India and Liberia through NGOs and social enterprises. And then governments were like, this is working, and it was passed over partly to governments. And I mean, I even say going back to the start of hospitals, like back into the year kind of 300 or 400 when the Christians started opening the first public hospitals. Like, hey, we're opening hospitals not just for ourselves, but for people outside of the Christian faith as well. And then over time, that got picked up by other organizations, and then governments took over healthcare. I mean, it's easy to forget, even in places like the US, most of the hospitals were originally started through Christian organizations, and then they became private, or the government took them over. So that's actually been the pattern in a lot of the world. And so I think that's as a mode for growth to kind of say, hey, we've got this idea, we've got this thing which is working, and then governments can come on board. That'll be our dream. It's not easy to get to that point, but that's the dream, yeah.
Yeah, because there is this common critique as well, right, that when NGOs operate in low-income countries, they might actually disincentivize the creation of government infrastructure if they're just basically taking the job off the government's shoulders. I have mixed feelings about this. I mean, there's a great episode on the 80,000 Hours podcast with, I think her name was Claire. I think she actually worked at JPAL. And she was talking, I think she was saying, hey, look, these governments are pretty burdened as it is. It's not like the Kenyan government or the Ugandan government draws a ton of tax income anyways. And so they might not even have the margin to do this. So it's not always clear that we're just like, crowding out the government's responsibility in operations here. How do you think about it with your role? Do you think if OneDay Health didn't exist, that in these 40 villages, there wouldn't really be some substitute?
Yeah, I mean, in Uganda, that's easy, and that's part of the reason we're doing it. Because 15 years ago, the Ugandan government said, well, we're not building any new health centres. We're just going to upgrade the current ones, which is different in different countries. For example, Ethiopia has a health post system, which they're expanding. Rwanda is building more health centres in different places. So it depends where you're working. And in Uganda, we're filling an enormous gap. And the other thing, just harking back to what I say, is if it's a really good idea and it really works, then there's a good chance the government can end up taking it over. And innovation often happens outside the government. In fact, I mean, I don't think anyone would disagree that innovation usually happens outside the government, and then the government can pick it up. I think there is risk of crowding out. Another great example of that, I think, is bridge schools in Liberia. I don't know if you've heard of bridge schools, but it's it's a social enterprise school system which is based off a tablet, and they can have kind of less educated teachers teaching the students, and there's good feedback. And basically they showed their outcomes were really good in Liberia, and the Liberian government said, hey, we'll take over the schools. And they said, that's great. And I think that can be a really good way of working together. I think there are cases, things where definitely it's not a good idea for NGOs to work there, where the government is already working. And I think the examples of that, I think, are often health camps, like within medicine. So there's a lot of health camps which come into like a health centre, and they provide services which the health centre is kind of already providing, but maybe they didn't have enough medications. So why didn't you just give the medications to the health centre rather than doing a health camp? So I'm usually pretty anti-health camps as a system. So there's plenty of interventions, I think, which can crowd out government services. So it's an important question.
Yeah, for some other discussion on this, we have an episode with Liz Hickson from New Incentives about their incentivizing vaccines in Nigeria, northern Nigeria. And I know partnerships with the government there are crucial for their success, as well as for deworming campaigns. We talked to Katie Fantacuzzi from, I think it's Unlimited Health now, used to be SCIF Foundation, and just to provide millions of deworming tablets every single year, you really have to be partnered with the government and with schools to do that efficiently and effectively. So I think sometimes this is pitched as like a, outside actors versus local governments kind of situation, when really it's more like, in the best case, some kind of partnership.
Exactly. I've got nothing to add there, JD. You said it well. Love it.
Well, and I loved what you were saying about Christians starting the first hospitals back around 300 AD. And I'd love to, I guess, going back to your story, ask how much was your faith a motivation for your work in medicine? And you mentioned you became a Christian at 15. Was it clear that you wanted to really model your career after certain Christian role models or examples you saw in Scripture? Or I guess this is a big way of, or I guess a broad way of me asking, like, how does your faith fit into the work you're doing right now, especially in medicine?
Yeah, I mean, I don't want to know what I'd be doing if I wasn't a Christian. It kind of scares me sometimes. I think that's one of almost my most scary counterfactuals when I look back and I'm like, wow, where would I be and what would I be doing? Because, as a 16-year-old and even as an immature Christian, I was just going along, doing my own thing. How can I kind of get a job and get a career and buy a house and be happy? And then really this justice group in the first year of university that I mentioned kind of turned all that around. And the passage, the passage for me, which just has blown my life apart, is the Sermon on the Mount. And I just keep coming back to it again and again. It was written over 2,000 years ago, and almost everything in it, you're like, this is so insightful, and this rings true to reality. And for me, like, the deeper I get into the Bible, into my faith, the more what Jesus says really reflects the way the world works, if that makes sense, which is kind of a reverse thing. Many people are like, well, I came to faith because, I had this moment and I was touched. It was an emotional experience, or maybe like the brain ticked over, oh, this makes sense. But for me, it was almost more like the Sermon on the Mount just describes how the world works with incredible accuracy. And also, like, when I try and be, the kind of person, Sermon on the Mounty kind of person, then I'm so much happier and integrated and better person as well.
Can you share a bit more about what in particular in the Sermon on the Mount affected you? And this is quite personal for me as well. I mean, my wife, she wasn't always a Christian before she became a Christian. She read the Sermon on the Mount and was just so shocked that was in the Bible. She thought the Bible was about lots of other things, lots of esoteric sacraments. And like, to be clear, I don't think sacraments are esoteric, but, I could understand and sympathize with someone who's reading from like a modern Western lens, who's like, what's all this like spiritual ritual practice? But when you read Jesus in the Sermon on the Mount, it is so insightful into our everyday experience. And were there any particular verses or aspects of the Sermon on the Mount that changed your life?
Yeah, I mean, the first one is actually probably the most esoteric part of the whole Sermon on the Mount, ironically, which is the start of it, which just described myself, like, blessed is the poor in spirit, for theirs is the kingdom of God. Blessed are the meek, for they will inherit the earth. Blessed are those who mourn, for they will be comforted. And when I was 16, I was like trying to be all that. I'm like, I'm trying to win the sports games and do well at school. And I mean, I was just a mess inside. I had this big ego, and everyone could see it, and people didn't like me very much, and that was fair enough. I was a pretty bad 16-year-old, and just this idea that when I had this humility towards God, and when I could see like all the issues with my own life, just that there was so much blessing in that, and so that was the kind of the first thing. And then the big one for me is which is just, I think it's brilliant and not talked about enough, is the worrying about tomorrow. Which is just really, really, it's a fascinating thing. Like, I was always worried about what people would think of me, tomorrow, and what whether I'd pass the exam tomorrow. Like, all of our worries and our fears are in the future. And obviously, there's lots of modern practices like mindfulness. I mean, it's not ancient practices, but are becoming like mindfulness and meditation. But just that idea that do not worry about tomorrow, because today has enough troubles of its own, and really, like, focusing on what God's doing now in the present, that was huge. And then some of the money stuff as well, like about opening up, like the do not store up treasures in heaven, is just a huge verse. We can talk about that a little bit more maybe in a little while, but yeah.
Yeah, I'd love to. Why don't we jump into that? And why don't we pull up the verse itself? I'll do that here in a second. But how does your stewardship of money play into your understanding of impact, and also with your understanding of faith and what it means to follow Jesus and radically live out your Christian faith?
Yeah, I mean, I love talking about this, JD. I'm trying to figure out where to start. I'm actually going to start with kind of a couple of things. So first, my favorite kind of Bible verses around this. One is this amazing story where someone comes to Jesus and they're like, should we give taxes to Caesar? And Jesus responds, well, yeah, give to Caesar what is Caesar, but give to God what is God's. And it's this crazy thing, like, yeah, pay your taxes, but give to God what is God's. And I interpret that as, well, everything's God's. Like, so I am, you are, Caesar is God's. Like, what is this little coin tax that we're paying when? And so this idea that when we think about what resources, what money we have in our hands at any one point in time, especially for those of us who might have more than enough, that they're not ours, they're just passing through. So how do we think, God would have us use these things which are in our hands, which are not really ours? And kind of following on from that, I think we have the even Christians, most Christians have the super individualistic idea about money. And I think we kind of put money, we kind of think about doing two things with money, which I think is weird. We think we should spend and saving. You hear people talk about, are we spending money or are we saving money? On one hand, we've got this capitalistic world flooding in, like, buy everything for yourself, food and stuff and experiences. And then on the other hand, we're told, like, oh, your future is uncertain and clear, so you need to save all of this money for your future comfort and security. So you've got kind of these weird two things going on, spending and saving. But I think, like, with that verse in mind, everything is God. I kind of like to think about using money. So we have these resources in our hands. So instead of thinking, what are we spending or what are we saving, like, how do we use this to bring restoration and goodness to ourselves and our families, but also to people who are struggling and to the environment and to future people? Like, how do we think about using God's resources which are in our hand now, rather than kind of getting boxed into what are we spending and what are we saving? Anyway, that's kind of my little take on that for a start.
Yeah, and I'm pretty astounded sometimes when I come across I don't want to pick on any one particular group or person or saying in particular, but when I come across like this normie Christian understanding of how to use money, and it goes something like this, in my context at least, use your money to take care of yourself and to take care of your family and tithe a bit to your local church, but the rest of it is really yours to do with as you please. And that once you pay your first fruits to God, you can really, barring any like extravagant or really directly harmful uses of money, you can use the rest of the money however you want. It's not a spiritual issue. It's not a moral issue. I think that comes into huge clash with the kind of vision you're painting here, really discerning from Scripture. And I'm going to read Matthew 6:19-21, which I think is a relevant passage you were citing, where Jesus says, "Do not store up for yourselves treasures on earth, where moth and rust consume, where thieves break in and steal. But store up for yourselves treasures in heaven, where neither moth nor rust consumes, where thieves do not break in and steal. For where your treasure is, there your heart will be also." And I think for many people, including myself, I think where I put my money is quite convicting in terms of showing me that at the end of the day, my heart isn't fully with the poor and it's not fully with God. And that's something that I'm continually repenting of and like striving to be more Christ-like in and asking for God's grace and help.
Yeah, I think it's so hard because the whole world and everything is just telling us, like I said, like you said, keep the money, like spend it on yourself, save it for yourself, compartmentalize this, but when you read the gospel, it's nothing. I mean, it's just nothing like that at all. And one thing I'm wrestling with at the moment is the idea of saving, because like, just from a biblical perspective, I really struggle to find verses which talk about, I mean, it's just, the verse says, don't, store up treasure on earth. Instead, have open hands and, see what's happening in the kingdom and let it flow, with the hands. So it's, that's not something I struggle with personally. I mean, obviously there's good reasons to save and be smart, and but I find it hard to see any real kind of New Testament biblical mandate to saving, large amounts of money, which is something I think we don't talk about a whole lot as Christians.
Yeah, it's also, it's difficult, especially when in Christian circles we also emphasize responsibility and caring for your own, especially for your own family. And there is this sense that to be a responsible father, for instance, that does involve having savings and having provisions. And even in average life in the West, in the US or in New Zealand, it's not cheap, right? Like even in average, in our podcast with Paul Niehaus, we were talking about how in an average church, not even an extravagant church, it's going to cost hundreds of thousands of dollars, right, just to pay the pastor and to get the guitar and the drums for the worship band. And this is before all the bells and whistles and like, let alone the smoke screen that you have, the smoke machine you have in a lot of
have to have that.
modern city churches right now.
You've got to have the smoke machine.
Right. That's I don't know, maybe very effective actually, but I'm definitely not the bread and butter. But yeah, there is a huge challenge here, and I'm wrestling with it as well myself as I think about how much to save for a future family and for my own retirement. But I think you're right. At the end of the day, we don't see Jesus talking about retiring in a nice earthly home, but we see Jesus talking about our heavenly home and storing up treasures in heaven. So
yeah, and I think this is also one.
I don't have a whole lot to add, but I just think this is really on point.
No, it's also something I've been challenged by the effective altruism community. Actually, is that I've seen people commit to generosity, the kind of generosity that sometimes I haven't seen within the church, and I almost found that a little bit shameful. I was like, why are we seeing people giving away all this money? Look, Christians have done that for years, and there's loads of Christians that have given away 90% of their income. I mean, think about heroes like John Wesley, who made millions of dollars effectively, and then said gave it all to ministry to keep churches growing and spreading, and lots of other people who are very quiet and diligently, so I'm not saying Christians don't do that, but seeing the conviction from people, effective altruists, to give away money to help the poor is actually really convicted and shocked me a bit in some cases.
Yeah. How did you get involved with effective altruism? And for those who are listening who don't know, effective altruism is this idea: use reason and evidence to find the very best ways to do good and then take action on that basis. It really emphasizes effective giving as a really powerful way we can have an impact, or an effective altruistic impact in this world. But then it's also a movement that Nick, you and I have been a part of. But how did you get involved? How did you hear about it as well?
I mean, I've got an interesting story in that I actually came into effective altruism kind of from the other side. So I was here in Uganda for 3 years, and I was becoming a bit disillusioned with a lot of big NGOs and just how inefficient they were. I live in communities, and the NGOs would come into the communities I was living in and do these programs and spend a lot of money and do trainings, and the community would look exactly the same after it than it did beforehand. And millions and tens of millions of dollars in Northern Uganda spent on agricultural training and development. And if you go to the village, people are still farming mostly the same way they did 100 years ago, And so I was becoming quite disillusioned with aid. And then someone recommended this book, Doing Good Better by Will McCaskill. And basically I read it. And as I was reading it, I felt like I was reading my experience, like in Northern Uganda. And I was like, wow, this makes so much sense that these NGOs are not like really optimized for efficiency. And they're not, they're not based on evidence. They're based on what they think will do good. And there's a lot of good intentions there, but good intentions aren't enough. And so that was my first kind of encounter with it. And that actually helped me to think about my own life as well, like as I was managing these larger health centers, but then to help me think about how can I, even more effectively help even more people than maybe I am right now. And so that pushed me towards spending more time and energy in OneDay Health rather than managing the bigger health centers and just working as a doctor. And then I follow my wife everywhere. That's how my life works. My wife got a PhD scholarship to Cambridge, so I followed her there, and I joined the effective altruism group there for 10 months. And it was my two groups. I was at the church and I was at the effective altruism group, and they were a really interesting group of people, and they helped me, understand the whole thing better. And then I got into the effective altruism forum about a year and a half ago, and that kind of reconnected me. I live in semi-rural kind of northern Uganda, and sometimes, to be honest, like I have my wife, but real intellectual stimulation and fast-moving discussions are quite hard to find sometimes, honestly, because a lot of people living around me are kind of struggling to make their everyday lives work, so that they don't have this luxury and this privilege I have to spend a lot of time thinking about a whole lot of other stuff. And so I found that really useful to help me think about development. And even to help me reflect on my faith and stuff around money as well. Yeah.
Mm-hmm. What do you think that Christians can learn from the effective altruism movement and ideas, and vice versa as well? What do you think the EA movement can learn from Christianity and from the life of Jesus?
Yeah, I find the story, this one Bible story, which I think is really interesting to come in here, and that's there's a woman who comes to Jesus and just pours this perfume on his head. And I was looking it up. It's about maybe $50,000 of perfume. And basically his disciples say, like, why didn't you give the 50,000 to OneDay Health, and save 20 lives kind of thing. Literally, like, why didn't you sell it and give it to the poor? And Jesus was like, what this woman's done is beautiful. She loves me. She understands like the significance of this moment, and she lavished this love. And so, yeah, I find it's a really interesting, like, kind of dichotomy, challenge in my own life between loving the people around you really well, and also being, really, really efficient and effective in your work and trying to save lives. And for my own life, like, in terms of when I came to Northern Uganda, I wasn't thinking about being the most effective. I was thinking about living, in the community and learning about them. And that's kind of what opened up this OneDay Health opportunity, was being part of the community and understanding the language and the culture and moving around and seeing this enormous gap that was there. I mean, I couldn't have found that, going on the internet, looking through a list of maybe effective causes. And so I think that living here in solidarity with the community is part of, what for me it means to live as a Christian here is hugely valuable. But I also think that, like I said, the NGOs, and especially, Christian NGOs, can be very, very inefficient. And, actually they want to be helping people, right? Like, as Christians, we want to see lives transformed. That's what we want to see, and if you're not doing that, then I think, I don't think that's the best. I don't think Jesus is particularly happy with that. So I think the effective altruism movement can learn that there's a lot to be learned from local, from local knowledge and local understanding, and a lot of causes and ideas can kind of come out of that. And the other thing I think is that I just believe, as a Christian, I don't think that, development and just having the perfect policy and the perfect ideas solves all the problems. I think people have deep spiritual needs, which the idea that we can solve all the world's problems just by putting all the money in the right direction, that's just not going to happen. And I think even in Western countries, we've seen big issues with that, over the last, 10, 15 years, that a lot of places things haven't become the kind of utopia that we hoped, with political division and conflict and dissatisfaction. And I think there's a faith gap there. There's a spiritual gap that people have in their lives. And it doesn't matter how much we work on our work-life balance, or consume the right content, or like, that's never going to be met. So yeah, that's a bit scattergun, but I hope that helps.
So I'd like to transition to talk a little bit about working in global health as a Christian, and also like Christian charity. And one thing that comes up a lot of times when I chat with people who are planning their careers is Christians feel called to work for a Christian organization. Or if they start something, there's this question of, do I start a Christian organization or non-Christian organization doing Christian things? I know Vida Plena has had some, Joy at Vida Plena has had some thoughts about this. I'm curious if you do as well, and feel free to talk a bit more about, I think you said it was the AMS. I don't know if that's like the Anglican Mission Society that you kind of sprung out of. But to my knowledge, OneDay Health is not a Christian organization, but you yourself are a believer, and it motivates your day-to-day life. Do you think there's a reason for health charities to be explicitly Christian? Or is what matters that you're actually serving the needs of the poor first and foremost? Can you talk a bit about those themes?
Yeah, I think it's a really hard question, and I don't think there's any right answers here. I mean, for OneDay Health, what happened is I went to the head of our organization, and I was like, look, I think there's this big opportunity here. I want to start like a charity, and what should I do? And he's a Kenyan guy, actually. He's a brilliant guy. So the head of New Zealand CMS is a Kenyan because someone worked with him in Kenya. They're like, this guy's brilliant. So they brought him to New Zealand. He's actually now become a bishop, which is super cool in New Zealand. But I asked him and he's like, look, no, I think what you should do is start an independent NGO, which is not faith-based, because that's going to give it the most opportunity to grow and do good. I mean, obviously, if you're thinking about like church planting or like obvious things like that, then it's going to be completely different. I think it's very, very situational. I think, and it depends on the nature of what you're doing. But I think it's very hard if you are thinking about really, like if you're thinking about the possibility of big scale and getting really, really big. I think there's a lot of it's you can get a lot more buy-in, a lot more people involved. If we want to work like explicitly with government and tie in with that becomes more difficult if we have specific, faith-based ways of working. So I think when it comes to scale for a health organization in the current environment, I think there's arguments for it not being faith-based, but I think it really depends on the situation. Yeah.
Yeah. And for people considering a role like yours, a nonprofit founder, working in the medical field, I guess there's a couple ways we could look at your role, right? You are a doctor, you are a nonprofit entrepreneur, you're a researcher. What does your day-to-day life look like? If I'm 16-year-old Nick and I'm considering like one day making the jump that you made, help me get a sense of what your day-to-day looks like from when you wake up to when you go to bed.
Yeah, I mean, at the moment, we walk out of our hut. We live in these two beautiful huts. I mean, we live in a little piece of paradise, is how I put it. I literally was in my garden today, and I'm like, I don't think I'm ever going to live in a more beautiful place than this. Like, we have a path from our hut to the outside toilet, and it's covered with bougainvillea leaves, the road to the toilet, and it's almost like something out of Lord of the Rings or something. As you walk out, and the golden light is gleaming through the bougainvillea onto the path. So we get up. Often we might heat water on our charcoal stove, and we throw it in flasks. Good quality flasks are an absolute godsend when you try to keep water warm. And then I jump on my bike, head off to work. And the office here is like an office anywhere in a Western country. We have computers and pretty stable power. I mean, we need to use the generator sometimes. It's a very normal office workplace. And then we might go and visit a OneDay Health centre in the village, which is about as different from a Western office as you could possibly imagine, and 50 times poorer than where I live. I mean, I live in this beautiful grass thatch hut, and I'm one of the richest people in the neighborhood, and that makes me feel uncomfortable. So when Western people come and visit us, they're like, oh no, you live without water inside, and you've got this, you don't have a fridge. And I'm living here thinking, my goodness, like, how do I justify living, with all this stuff and in this luxury, when everyone around. So it's really interesting getting different perspectives on that. But so you're continually moving between worlds of extreme poverty and kind of not at home and not in the office. And sometimes you get used to it and it's just natural. And other times you reach a potential OneDay healthcare black hole, and you just feel this compassion and this heart. And even if it doesn't make sense to start a OneDay Health Centre, you just want to start one, like, we can help people here. And yeah, it's an interesting mix between trying to remain compassionate and like alert to what's going on and not being overwhelmed all the time. Yeah.
And that's so fascinating. And who would you recommend go directly versus maybe stay at home? And what we didn't talk about is like paths for impact and how you would compare, oh no, I didn't ask this question earlier. I just think we should bring it up now, right? Like there's a version where Nick, you stayed in New Zealand and you did the earning to give path, right? And a great example of a doctor doing this is Jason Dykstra, who we had on in another episode. He's living in Michigan. He's living very modestly, I mean, very much within his means, and giving a large amount away to support to support global health charities like OneDay Health to prevent malaria and save lives. And he'll tell you he has much greater impact by giving to effective global health charities than he ever does directly in West Michigan. Now you can have more impact if you go to Uganda, right? And your boots on the ground, and you scale up some effective charity. But did you ever kind of do that calculation or sit and pray about, should I go back to New Zealand and earn a lot of money and just fund organizations, or should I go directly? And, how would you recommend somebody who's kind of still in medical school, or someone who's kind of early career, kind of weighing those trade-offs?
So firstly, for me, it was straightforward because I only got into effective altruism kind of 7 years ago, well after I was already embedded in life here. So I didn't have that question to ask, which is a really difficult question. One thing I'll say is if people are not sure, I think go out and go to come to Uganda, come live in this hut here where I'm sitting come for 3.
Is that an invitation?
Yeah, it's a huge invitation. I mean, we have people come here a lot. We've actually, one of the doctors that works with OneDay Health, Kristen's American. She's, I think, in her 50s, and she's actually just bought a piece of land 500 meters from where I'm living now. And she's going to split her time between the US and coming here because she came here. And so I think a really good amount of time is between 3 months and 6 months. I think that's good. I think 1 or 2 weeks is not enough. I think if you've got it on your heart, you're like, and I don't mind the Christian idea of calling. It's kind of cheesy, but I think there is I think you can get more confidence. Okay, I'm getting drawn to this, and then you go and you try it for 3 to 6 months, and then that's what I did originally. We came on a medical elective here, I think 15 years ago, to Western Uganda for 3 months, and after that, I was like, yes, this is what my heart is in. This is where I want to go. I mean, I personally, I don't think I could manage earn to give. My heart is very fickle. I mean, I mentioned what I said. If I wasn't a Christian, I don't want to know. I think if I was earning a lot of money, I think my values would change. I think I'd really struggle. Other people, I think some of the strongest people are the people who can earn a lot of money and give a lot of it away. I mean, I have so much respect for that. I think it's really, really, really difficult thing to do. But my big advice is, if you're not sure, come and try. And some people come and they work and they're like, that was fine, but there's no way I can work in care. I'd say the majority of people who come and volunteer for short periods are like, I don't think this is how I want to spend my life. But I really think there's a lot of value in spending 3 to 6 months, in a place like here or anywhere which you're connected to. That's my one real piece of advice I always give.
Do people ever come and you think, there's no way they're going to last like 3 weeks here? Like they're going to want to go home. And
I mean,
I'm sure you wouldn't want to tell them.
No, I mean, there was only one experience, which was not one of my volunteers. This is actually when I was working at a big hospital, and it's fascinating because there was 60 patients, and she was supposed to see 60 patients in a day, but the first 5 of them were sicker than patients she would ever encounter in America. So she just couldn't get past the first 5 patients. And the local doctors were looking at their watch. If the tests aren't ordered for these 55 patients, they're not going to get their test for the day. And after a few weeks, she was like, I just can't do this. I can't not give my best to every person, because often that's what you are left doing. There are people whose lives you could be saving if you spent 3 hours. But then what about the other 30 people? So I think personality is really, really important. I think for extreme perfectionists, I don't think this is the place to be. And a lot of doctors are extreme perfectionists, to be honest. But I do want to say that it's really sad that more people are not living and working in these places. Like, I think in terms of kind of doctors working overseas, the numbers have been dropping, and they've been dropping for some time. In terms of, there's very few people who stay for 5 or 10 years. And I think there's a lot of reasons for that. Part of it is because perceived financial pressures of youth in America, and that security thing I was talking about, which I actually think churches should be able to solve that problem. The church should be able to be like, look, you go there, you don't earn any money. If anything goes wrong, come back and we'll just sort you out. We'll sort you out when you come back. That's what I think churches should be like with people who are keen, but I don't know. And then
are there any organizations you would recommend if someone is in the medical path, like going to try to? You mentioned very generously you'd be interested in inviting people to stay with you, but are there other organizations or other programs that maybe are like, I don't want to say like cookie cutter options for like 2 month abroad, because it's not a trivial thing.
No,
like it really needs to fit your interests and your sense of calling. And
there's hardly any, actually. There's amazingly at the moment we're getting volunteers for our bigger health centre through a British government program. So if you're a training doctor in England, there is opportunities partly funded by the British government to come and work here or in a lot of other places. So if you're in England, there's good option. In America, I think mainly it's facilitated by churches, and it is a role that churches can play, is to give people, like, even moving outside, obviously, strict faith stuff, give people the opportunity to have much bigger impact in their lives. So I think churches should be supporting and paying for people and encouraging people to come for, 3 to 6 months. But the simple answer is there aren't many cookie cutter options. It's actually really difficult for people, and there are big sacrifices. I mean, I don't love the word sacrifice. Maybe I shouldn't use that word, but what I mean by that is that if people come here for 2 to 5 years, often they can lose their medical license, or it's harder to specialize. So there's a lot of trade-offs to be had. So I'm not I'm encouraging you to come. That's why 3 to 6 months I think is good, because you don't lose much in a trade-off for 3 to 6 months, really. And then you can decide, okay, is this a 5-year thing for me, or is this, or a 10-year, or is this not? But the simple answer is cookie cutter options are not usually there. Yeah.
This is exactly why we recommend, here's a shameless plug, our Christian Impact Mentorship, which is a way that people who are still discerning their career path can get connected with mentors, people like Nick, who have walked the walk and can help you really pray with you in your individual situation, get a sense of where God might be calling you to really live the life you're meant to live, but also have a huge impact doing that within your individual circumstances. So big plug for that. And Nick, did you have any mentors in your life who were especially influential?
Yeah, I mean,
putting you on the spot here.
No. There's mentors which I knew and mentors which I didn't know. Kind of the one really big one was, there was this guy at church who was he really simple guy. He went to Uganda for I think 15 years and started up like a carpentry vocational institute under a church diocese in eastern Uganda. He hardly talked about it, and then my wife actually went and visited, and she was like, oh my goodness, it's 15 years after he left, and there's this kind of flourishing trade school that's connected to the local, and she was like, this is amazing. And this guy used to come to the young people's church services when he was like 65, and he was a real inspiration to us and part of the connection, our connection with Uganda. And I think there's so much value in older people and younger people connecting like that, even if it's not the most straightforward of relationships. There's also a doctor from New Zealand called Edric Baker. There's actually a book about him called Dr. Brother, which I'd recommend for any kind of budding doctors. And he went to Bangladesh and started up, classic kind of thing, a couple of hospitals in the bush that were so efficient, like so incredibly. And I actually encountered his work before effective altruism, and it had a lot of effective altruism-y kind of ideas. And he innovated in a lot of ways. Like when he treated diabetes, he used people's urine and chemicals rather than using the expensive, electronic machines to treat diabetes and stuff like that. And he was treating patients for, cheaper even than OneDay Health was treating patients. And so Edric Baker was a real inspiration. I met him once in New Zealand, and it was amazing. He came to church to do a speech, and the church was full of Bangladeshis, and there were hardly anyone else. This is in New Zealand, and it turns out this guy's like a hero in Bangladesh, and no one's ever heard of him in New Zealand, which was really funny. And these were Bangladeshis; they were mostly Bangladeshi Muslims who were there, and they were like, "Oh, this guy's amazing! He's got this hospital, and he's working here." And I was like, "What's going on?" So yeah, that's Edric Baker, and a really interesting book, Dr. Brother. So a bit of a plug for that one as well.
Wow, that's incredible. And any advice for leaders, people who want to start something? You're not just a doctor, you're not just a researcher, you're a nonprofit entrepreneur, really. And you oversee a lot of people, and you envision new projects, and you pitch that dream to other people. Any advice for people who are thinking of starting their own charity or own organization?
Yeah, I mean, I've kind of got almost anti-leadership advice, which is, I think if you want to work in a field and do really effective work, I think get your boots on the ground for a period of time. So what I mean by this, if you want to start a teaching charity, maybe and you're going to do leadership, maybe spend 6 months, teacher aiding or something in the kind of place that you want to work in. If you want to be a doctor, work in those places. I think these days often leaders want to shoot for the top very quickly. And I think there's risk in that. People can really disagree with me here, but I think there's a lot of worth in going slowly at the start. The first 6 months, the first 1 year, really understand the context, understand the problem. And the best way to do that is to be working on it. My favorite charity, education charity here, it was co-founded by a Ugandan and Australian woman, and she worked teaching in a Ugandan primary school with 120 kids in her class for a year. And then she's like, okay, these are the things that need to happen. And it's matched so closely with, it's called Read for Life, that's matched so closely with the values of actually an effective altruism charity that they last year actually gave them a bunch of money to continue their work, which was super cool. So I think there's a lot of value in being humble and like working in the area that you're thinking of leading, whatever that is. Yeah, that's my advice.
Nice. I know you've also talked at other times about testing things out, like trying new things, finding others who've tried the idea that you're interested in, talking to them, really trying out a bunch of things, seeing what sticks, seeing what works and what can scale.
Yeah.
Anything you would add to that? Or?
Yeah, I mean, this is the thing. Most things have kind of been done before. So we love thinking about innovation and we love thinking about being the first person to do things, but I don't think it matters being the first thing. I mean, like Ethiopia, for example, they've launched these health posts that are similar in some ways to OneDay Health. And, we got some inspiration from, okay, that's working there. Maybe similar things could work here. Like in such an interconnected world, a lot of things have been tried. Like find the people who have tried them before and talk to them. There will be someone out there who's tried or done the thing you're thinking of. And I'd say this especially actually for Christians who are thinking of doing, because Christians are often very trigger happy and like starting NGOs or funding something or doing something. And I think there's a great impulse there. But there's enormous value in talking to a bunch of people, like the local people in the country you're helping, and maybe people who have funded or done that stuff before. Like people have probably done what you're doing. I hate to break it to you, but it's probably the situation. So talk to them. Yeah.
Another plug for Impact Mentorship. Talk to Christians who are 3 years ahead of you on your very similar career path, who might have some insights and wisdom to share.
I love it.
Yes. Well, we're wrapping up here. Just on this point of career advice, any final parting career advice you would give to any listeners who are still discerning what is this radical calling God might have for their life and a way that they can use their career to advance God's kingdom?
Yeah, I'd say like try and find a way of like moving towards the way of Jesus and away from like what the world is telling you. Like the world is telling you need to save up a lot of money, you need to have this career, you need to do all these things to make your life secure and safe. And there's some truth in that, but there's also a lot of lies. So like when you're making your decisions about what to do, like turn to your Christian mentors and turn to the Bible and the Sermon on the Mount rather than what everything else is screaming at you. I think the biggest issue is people just not doing things. People just going on with their career and their life and not making a decision to maybe do things a bit differently. Yeah.
Awesome. Nick, is there any way we can be praying for you or supporting you in what you're doing at OneDay Health?
Yeah, I mean, really thoughts about Malawi and whether that's going to be a goer or not. Like we want to make good decisions. We really want to use donor money well. Obviously, if we start there, it could fail, but we want to give it the best chance of success. So that's the thing which is really kind of on my heart at the moment. And also about this trial, like if we can get a trial going, and that would be great. And also this, like the question, obviously, it's going to cost a lot of money, and thinking through both the ethics of that and raising that as well, I suppose. Even though that's a bit. So I think the trial and that are those are two things I think to pray for. Thanks.
Awesome. And we'll include any links to OneDay Health or any of the resources mentioned in this episode on the podcast page on our website at christiansforimpact.org. Nick, thanks so much for joining me. It was really a pleasure. And I'm sure this won't be the last conversation, but just really love what you're doing and so inspired by your heart for God and for the poor and vulnerable.
Thanks so much, Shetty. Honored to be on this podcast. You've interviewed so many awesome people, and it's so cool to be here.
Hey listeners, thanks so much for listening. Let's continue to pray for Nick, but also if you're interested in careers that have a maximum impact tackling preventable diseases, we would love to support you. We have a website at Christians for Impact, and we have a profile on preventable diseases with what we and the researchers we've talked to think are the highest leverage solutions to that problem. We'd also love to give you free one-on-one career advice. If you sign up for our mentorship, we'll pair you with a mentor, someone like Nick, someone who is a few steps ahead of you career-wise, who would love to give you tips on skills to build, internships to do, jobs to apply for, and also just pray with you through that process. We'd love to support you with that. Thanks so much for listening, and we'll catch you again next time.